next we'll move into law enforcement, and we have Under Sheriff Boatwright. Can you identify the hotspots for fentanyl use within the community? Where do you see it more prevalent? I know you mentioned social media earlier, but where are areas that people are using fentanyl?
Well, Supervisor, unfortunately, fentanyl does not discriminate. Whether it be the college student using it for the first time or our homeless population taking part in it, everybody in the community is susceptible to it. So pretty much there's not really any hot spots. It's just that fentanyl is just a type of drug that everybody should be very aware of and know that it's out there and that they can be susceptible to it.
Now, I appreciate bringing that up. You mentioned that it could be a high school party. It could be
Correct.
Our first responders going out to respond to a homeless situation. So I think it's important for the general public that this is not one area where you look for it, but it's everywhere.
It's everywhere.
So I appreciate you doing that. So I know that you mentioned earlier some data, but what data is available for fentanyl-related deaths and overdoses in our community?
In San Bernardino County, we had 350 fentanyl deaths in 2022. And so far in 2023, we have 136 deaths right now.
Wow. It seems like those numbers look like they keep spiking and keep spiking. It's very unfortunate for those families and loved ones that have lost their families. And a final question I have for you, Under Sheriff. What are some new approaches being adopted by law enforcement to try to address this fentanyl crisis? What are you doing different? Because this is not what it was 20, 30 years ago. Maybe share some of the things your department's doing.
We had two programs that we started up. One was Operational Consequences, and the other was the Overdose Response Team. Operation Consequences started in 2022, and since that time, we've taken 181 pounds of fentanyl off the streets. So it has been very, very good in terms of dealing with this fentanyl issue. However, there's more work needs to be done. In February 2021, our department created the Overdose Response Team. This team consists of two rotating teams, and they're on call 24/7. And so basically, when they have a fentanyl death, they go out and just to investigate that particular fentanyl death. And they also we treat like a homicide. And I think just recently, in the last week or so, we got our first conviction of someone dealing fentanyl in that process.
We appreciate the congratulations. I like the fact that your department is now taking a proactive approach
Right.
instead of waiting to find someone that has passed or waiting for a tragedy to happen, but trying to be proactive on this and try to address the drug dealers and stop it at the front end. So we appreciate that, Sheriff Boatwright. Next we'll go to our next panelist, District Attorney Jason Anderson. So Jason, thank you for being here, but can you share some recent examples of fentanyl-related prosecutions where you actually prosecuted someone for either the distribution or selling of fentanyl?
As the undersheriff indicated, we just finished a trial where someone got convicted of involuntary manslaughter. We're in the discussions with some other agencies that are investigating fentanyl-related deaths, including the Fentanyl Response Team at the Sheriff's Department to guide them on those types of cases. In those cases, you have to show an implied malice or a recklessness. And so we have to, be true to the rule of law to make sure that we have what we need when we move forward to prosecutions. But that collaboration is important. We also prosecute the dealers, clearly, when we have cases of transportation or selling to others. I will tell you that the information that we've received because of the response by the local agencies of their aggressive prosecution of fentanyl, we have had conversations in which individuals have been recorded talking about, hey, be careful about dealing fentanyl in San Bernardino County because they'll actually prosecute you if somebody dies as a result of that person getting the fentanyl. So if it's within the underworld that we have a reputation that we're looking to get these things aggressively, we kind of take that as a badge of honor that the crooks are talking about. This may not be the place where you want to deal it. There may be other jurisdictions in this state where it wouldn't be as harsh, but we certainly don't want to send that message. And so we're doing what we can to hold people responsible, but also the residual of that is that the word's getting out that we take it serious here because we value people's lives.
No, we appreciate your response on that, and congratulations on the prosecution. I think that's great, and sending a message to our community that we're here to protect you, I think, is number one. But you have great partnerships with the Sheriff's Department, and I think one of the things I appreciate is your diligence. Despite some of the challenges on trying to prosecute someone, you've been diligent and stuck with it, and that really means a lot to our county and our county residents. So thank you for that, Mr. Anderson. Can you tell us about the Act Now campaign and its objectives? I know you're heavily involved in it. Tell us a little bit about the program.
It was actually developed within our public affairs office. Jackie Rodriguez came up with the Act Now, and we've expanded it actually working with Mr. Filston and other groups that are very involved in the educational component that he talked about. But we knew we had to go out to schools. As the doctor talked about, the prevalence of the drug knows that it's going to hit kids, period. It's going to be out there because it's so cheap and it's so prevalent. So we started it off in the schools. We've actually expanded it to faculty and staff, making teachers aware. But the component of it is just how easy it is, even unknowingly, to have somebody have an overdose or a death as a result of fentanyl. I'll give you a quick example. So one of the analogies that Jackie uses is she passes out Skittles to the students. And as you know, Skittles, multicolored candies, they all taste the same. So she'll pass out Skittles, and we've had assemblies up to 400 students. So they all get a Skittle, and then she says, hey, pass your Skittle to the person to the right. And they all do that. And then she'll say, if you have this color Skittle, you're dead as a result of a fentanyl overdose. And if you're dead, she says, stand up, walk out of the assembly. So then it's poignant, right? Because the classmates see this number of people just drop dead. And then she says, okay, if you pass that Skittle over to your friend, you might be prosecuted for providing a poison to your colleague. And it's that easy, even if it's unknowing. Obviously, if it's unknowing, we're not going to prosecute that person for murder, but the message is sent. As Mr. Filson said, there's no such thing as a safe street drug anymore. There's no such thing. You have no idea what that Skittle contains, and in that instance, it shows that if it contains fentanyl, the likelihood is that student's going to die.
Yeah, no, we appreciate the Act Now program and the fact that your public affairs department has taken a lead, but really trying to illustrate in layman's terms, in plain terms, to understand how easy this can be distributed and how easily people can die with it. And we appreciate all your advocacy and trying to get to the schools and get to these kids at an early age and really educating our community. But thank you so much for that. Appreciate it, Mr. Anderson. Next, we'll go to Mr. Filson. So, Mr. Filson, you've been actively involved in raising awareness about fentanyl. Can you tell us why this issue is so important to you personally?
Victims of Illicit Drugs, which is the organization, nonprofit that we formed back in June of 2021, was formed by a group of bereaved parents, myself and 3 others, due to the fact that we lost a child. Why is it so important to me? I want my daughter's death and her legacy to be one of saving lives. And in saving lives, we've approached the problem from our perspective, and what our responsibility to be is education and awareness. Knowledge is power. The more knowledge that is out there relative to the dangers, again, of fentanyl, the more potential we have of lives being saved and people not being exposed to it. We looked into the 3 areas, again, education and awareness. We have the enforcement component with the district attorney and law enforcement. And we also then have a most important component, probably, is the treatment of addiction that has long been ignored through our society, both with addiction and mental health issues. We're starting to approach that in a different way, and hopefully we can eradicate the problem even more. People are being deceived into taking something that they think they're taking, but it's not. In being deceived, they're being poisoned. And in being poisoned, sometimes we get enough information together and evidence in order for the law enforcement component and the district attorney to prosecute people for murder. We have to understand and again change that narrative from that of overdose, which goes to the stigma of addiction, that an addict is taking something he wants to, that's their choice to do it. No, this wasn't my daughter's choice to take fentanyl, but she unknowingly did, was deceived, and died. How do you change behavior? We changed behavior over the last 3 years through COVID. None of us are ever going to forget that we need to stay 6 feet away from each other and wear a mask in order to minimize the potential for COVID exposure. Why isn't that same information out there relative to the potential exposure and death from this illicit drug that's being distributed illegally throughout our country? Knowledge is power. We need to change the behavior. Not using drugs is the answer, but I'm certainly not naive enough to know that that is ever going to occur. But I think the more people that understand the lethal potential of fentanyl, the second thought they will have before they try to use it.
And we appreciate that, Mr. Filson. You bring up a good point. Kind of to the doctor's point is how some people are addicted to it, but you're referring to maybe experimental, the first-time users, someone that may be at a party or hanging out with some friends and they try it for the first time. And as the doctor mentioned, all our bodies are different. We all react differently to that, and people can lose their lives. we appreciate your passion, especially through your personal loss and really advocating with parents. We just want to say thank you for doing that for our community.
First-time users are the ones most likely, or the experimenters are the most likely ones to suffer that fatal dose. And we have to get that message out there.
Oh, that's a great message, Mr. Filson. So, Mr. Filson, could you also explain the purpose of the Void and how it is contributing to fentanyl awareness and prevention? Tell us about the Void.
Void, Victims of Illicit Drugs, that's our organization. Our passion is nothing but education and awareness. We'll involve ourselves in certain legislative activities and things like that to try to get changes in the law. The naloxone project within the state of California, Assemblyman Ramos pushed something to that effect here last year, got it through. And but as far as our main purpose, it's getting that word out. And most importantly, to our youth. Our adolescents, our teenagers, our young adults are the ones that are most impacted by this. I work at a public charter school. I'm at the Public Safety Academy out here at the airport. We have 400 kids out there. Each and every day, I worry about one kid, are they going to bring something out here, and we end up finding somebody there. We have naloxone on campus, our red bags in each classroom, and I carry it with me at all times as a preparation. But we have to be prepared, and I'm constantly worried about not being able to get this message out to the public. San Bernardino County Schools, San Bernardino City Unified, and other districts throughout the county are starting to provide access to speak to their students, which Void is trying to do. Our program involves showing our video, which is titled Dead on Arrival. It's 20 minutes long. Give us 50 minutes and we'll get a message out to your student population in the form of the documentary. We'll show a brief PowerPoint presentation, and most importantly, we then open up for questions and answers from the kids. There's nothing that's out of bounds. You ask me anything. I'm not ashamed of my daughter. I miss her every friggin' day. But for fentanyl, she would still be here, and I would be able to understand and help her with any type of issue she did have. That's the message I want the kids to understand. Ask me anything you want. I will answer the question with the intent of, again, my daughter's legacy being one of saving lives.
No, we appreciate that, Mr. Filson, and you really trying to advocate for all of our schools in the county and throughout the state. I know you've been advocating for legislation at the state level, so we appreciate that. And with your organization, Void, and the parents, everything you're doing. Well, thank you so much. And as we wrap up this panel, I'd like to give each one of our panelists an opportunity to maybe to give a closing statement as we wrap things up. I'll go ahead and start with you, Dr. Revlos.
Thank you so much, Supervisor. I would mirror what Mr. Filson said in that education and information is the first step. I would add, from a treatment provider perspective, that when use does transition into an addictive disorder, treatment works. People respond to treatment with medication and behavioral intervention at the same rates that they respond to treatments for high blood pressure. Don't be afraid of treatment. It works. Thank you.
I appreciate it, Dr. Revlos. And Under Sheriff Portwright?
Yeah, well, I will add that as we all on this panel know, that fentanyl is a deadly, deadly, deadly drug. And I agree with Mr. Filson that the education piece has to happen. But I also think that our legislators needs to be more serious and more deliberate and really attacking this particular issue head on, because we need them right now to really, really come on board and to really attack this problem, because we got kids that are dying, we got families that are mourning, and we got families that are just devastated because of this drug. So my hope is, and I pray that our legislators will also come on board and really deliberately get involved with this particular effort that we're trying to move into our community as of deal with this particular drug that we call fentanyl.
Appreciate it, Under Sheriff Portwright. And D.A. Anderson, some closing remarks?
Yeah, if you look at the statistics that Under Sheriff Boatwright talked about earlier, it's basically like a plane full of 110 people going down every day. If that were happening, I guarantee you in this state and on the federal level, we'd be having hearings calling in the FAA, people in charge of airlines, and go, what the heck's the problem here? Is it a mechanical problem? Is it a training problem? Is it an educational problem? And we'd fix it real quick. Well, we have more of that going on, and yet We don't have quite the law and order response from the legislature that we would like. So what we can assure at the local level from law enforcement is that we're going to be creative and we're going to be strategic to hold you responsible. If we know you're dealing it and you take the life of somebody, or you're just continuing to deal it, we're going to be after you and we're going to hold you responsible as much as the law allows us.
Okay, appreciate that, DA Anderson. Mr. Filson, closing remarks?
Most importantly, fentanyl changes everything. Don't ever forget that. One thing that we didn't mention, pills. Pills are the most potential that our children, our adolescents, and the young people are taking. If you don't get your pill from a doctor, from a licensed pharmacy here in the United States, don't take the pill. It's 100% fake. Every pill off the street, off of social media, is nothing but a pill that contains a neutral binder and fentanyl pressed to look like oxycodone, Percocets, Xanax, Adderall. And that's what kids are looking for whatever friggin' reason. You don't get the pill from your doctor or pharmacist, don't take it. It's poison and you'll die.
No, that's a great message. And that's a great message from all of you. And just, on behalf of the County of San Bernardino, I want to thank our panelists for participating and sharing this message and really all the advocacy they do, everything they're doing to try to educate, but also preventive care that's being done, some of the responses from our deputies and responses from our DA. So, on behalf of the County of San Bernardino, I want to thank all of you for tuning in on this important issue of fentanyl. Let's continue to educate our community and show the importance of trying to address this issue, but also share with your family and friends and your loved ones, because, we don't want to see anyone in our community lose their lives. So on behalf of the County of San Bernardino, I want to thank you all for tuning in and have a great day. I would like to extend my gratitude to each of our panelists for sharing their invaluable insights and expertise. Our community faces a multifaceted challenge with the fentanyl crisis, and it's essential that we approach this issue with education, compassion, and coordination across various sectors. It is also important that we as community members remain informed and vigilant. This crisis affects all of us, and our collective efforts are vital in fostering a safer community. I encourage all participants and viewers to continue educating themselves and others about the risks associated with fentanyl and to support community-based initiatives aimed at reducing harm and improving public safety. Finally, let us continue this conversation beyond today, as ongoing dialogue and collaboration are essential to effectively address the fentanyl crisis.